well. I just want to start by saying there has been a lot of work done over the last couple of days since we last had a press conference. And a lot of that work is very hopeful. And there are a lot of hopeful developments in our state. Tennessee is a very innovative and creative place. We have brilliant healthcare minds here in particular. And there is great work, not only in what we're doing to address today's situation, but to address this virus and its impact on the country in the months ahead. At UT Health Sciences Center in Memphis, they are developing and testing right now drugs to attack COVID-19. In Oak Ridge, the supercomputing power we have there is developing a model on how this virus travels that will help our country understand and better attack the virus over the coming months. Right here in Vanderbilt, there is hard work to identify coronabody antivirus therapies. So we've got really brilliant minds developing really innovative ways to attack the virus, but we're also doing things every single day right here to make sure that we keep Tennesseans safe. And it's hopeful for me. These are hopeful developments because I know that we're going to overcome this. We're going to get through it, and my goal is to get through it with the best possible results that we can get here in Tennessee. So I want to give you some updates, some reminders. Our current confirmed cases in Tennessee is 615. Yesterday, I signed Executive Order 17. It'll remain in effect until April the 6th. This pandemic is not only a health crisis, but an economic crisis, and the decisions that we're making every day are trying to alleviate both of them. Executive Order 17, we believe, does that statewide. It prohibits social gatherings of 10 or more people. Restaurants are exclusively to offer drive-through, takeout, or delivery options to support families and businesses. Establishments can sell alcohol by takeout or delivery with the purchase of food in enclosed containers to those who are 21 and older. Gyms are to temporarily close. Bars are to temporarily close. And I've limited nursing homes to essential care visits only, remembering that the elderly are the most vulnerable population in our state. They're the ones that we need to take care of the most. I will say that earlier today, I spoke with and have had continuous conversations actually with mayors of our major metropolitan areas across the state. And we talked specifically about their targeted solutions in their high density areas to keep their populations safe. And I certainly support those solutions. This virus does not act the same in high density areas as it does in other areas. It's not a one size fits all solution. And that's why leaders across this state are working together to make sure that our concerted efforts are mitigating this disease to the possible, or this virus to the degree that we can. My focus today is going to be the establishment of what I'm calling the COVID-19 Unified Command. I want to provide an update regarding our efforts to acquire more personal protective equipment. And I want to discuss Executive Order 18, which I signed today. The scope and magnitude of this pandemic requires governments across the world to rethink the traditional approach to problem solving. It has required this state and me as governor to rethink our approach as it has developed to attacking this in a more aggressive way. So today I'm announcing the establishment of the COVID-19 Unified Command in Tennessee. I've appointed Commissioner Stuart McWhorter to head this strategic joint effort between TEMA, the Department of Health, and the Department of Military. Commissioner McWhorter will step away from his role in finance and administration as the Commissioner of F&A to head this very important effort. I have appointed Eugene Newbert as acting Commissioner of F&A, while Stuart McWhorter steps in as the director of the COVID-19 Unified Command. We have appointed retired Brigadier General Scott Brower to serve as Chief of Staff for the Unified Command. And the command itself will consist of Dr. Lisa Piercy from the Tennessee Department of Health, Major General Holmes from Department of Military, and Patrick Sheehan from TEMA. I've appointed the Unified Command to effectively change the way we attack COVID-19 in Tennessee as we work together to simultaneously address the health and economic crisis. This team will be tasked with finding innovative, creative, quick decision-making and efficient approaches to testing, to medical supplies, for hospital beds, for hospital capacity, for quarantine strategies, for the increase of medical personnel that will be needed as this virus increases in our state and the health needs associated with it. So it's a very important strategic decision that we have made structurally in the governor's office to make sure that we are doing everything we can in this state, innovatively and creatively, to get through this with the best possible results at the end. I want to give an update on personal protective equipment. It's a lot of conversation in this country and in the state around the need for medical supplies and the fact that those supplies have dwindled as the virus has increased across the state. But I'll start off by saying I was on a phone call today with the vice president and a number of other governors, and we were talking about personal protective equipment and how it's being distributed around the country. And let me just say, there are some very promising developments that are happening in the coming days, as has been happening over the last couple of weeks. But there's a tremendous national movement toward the production of personal protective equipment for states all across the country, and we will be beneficiaries of that. It's hopeful, but we are not depending on others to find and source personal protective equipment for our state. We're working really hard within our own departments to do that. We have dedicated resources there. And part of what we're doing is trying to, again, to be innovative and creative. And I want to give you an example. I want to give everyone an example of what's happening in our state and effective, creative approaches to this. So we have 8 of our higher education institutions, four of which are TCATs, by the way, who are 3D printing face shields. These face shields will allow a healthcare worker to extend the use of their face masks when dealing with COVID patients. I show this because it's just one small example of the way that we're utilizing our institutions of higher education, the manufacturing companies across Tennessee, our private sector health providers, all working together to aggressively increase the supply of personal protective equipment that will allow our incredibly important frontline healthcare workers to operate safely. And that is a tremendous focus of ours as these men and women put themselves in line to treat those with COVID-19. I want to talk about Executive Order 18 as it relates to personal protective equipment. Today, I signed Executive Order 18, which prohibits hospitals and outpatient surgery centers from performing elective surgeries. It prevents dentists and dental clinics from continuing dental services except for emergency dental services. And practitioners are asked to donate their personal protective equipment from those facilities to the nearest National Guard armory. That executive order goes into place until April 13th. So in effect, what we're doing is closing down outpatient surgery centers and dental clinics to provide, for a temporary time, to provide personal protective equipment that is stored in those facilities or that are a part of those facilities for the greater healthcare use for COVID-19. One of the other things that it allows us to do is have access to ventilators through the Association of Anesthesiologists who've been working across the country to free up these ventilators that are used in outpatient surgery centers and adapting those for use with COVID-19 patients. So this one move will both free up PPE and medical equipment like ventilators that are going to be incredibly important in the days ahead. We will take these steps one at a time. We will sign executive orders one at a time as needed, all in an effort, all all in an effort to keep Tennesseans safe. I'll give you an example today of just one step forward in personal protective equipment. We look every day to order masks and suits and gowns and shields. And even today, I talked with Dr. Piercy, and we received 430 Tyvek suits today. Just one example of what we're doing every single day to step by step improve the supplies that we have as we anticipate an increased need for all of those. Before we go to questions, I will close just by saying this is a time for innovation, and there is no one better than Tennesseans who can innovate. There's no one better than Tennesseans who can step up to the plate and can do what is necessary to address this. We will get through this, but we want to get through this like Tennesseans. We want our neighbors to help their neighbors. We want our neighbors to serve the elderly. We want Tennesseans to go out and give blood because there's a national shortage. We want Tennesseans to stay home if they can stay home. Quit going out if you don't have to go out. Don't gather with people if it's not absolutely required that you be there for some essential service. This is incredibly serious to the state. It's incredibly serious to the lives of Tennesseans. Every single Tennessean should wake up and take personal responsibility for saving the lives of the people around them and for saving the livelihoods of their neighbors. Because if we can mitigate this in a substantive way, then we can minimize the amount of financial damage that occurs to Tennesseans. It's time, and we of all people can do it. So we want to open this up to questions. I'm going to ask Major General Holmes from Department of Military, Director Patrick Sheehan from TEMA, Commissioner Stuart McWhirter, Dr. Lisa Piercy from Department of Health, and Brigadier General Scott Brower, who all are a part of the COVID-19 Unified Command, to be available for questions as well. They're available here in the room for questions, and we will take those questions via technology now.
Great. All right. Thank you, Governor. And we'll open this up to questions. I'll go ahead and call you out. If you could just repeat your name and your outlet and then proceed with your question. And if you do have it for one of the Unified Command members, please be sure to designate that as well. First, we'll go to Jonathan Matisse with the AP.
Hey, Governor, can you actually hear me?
Yes, sir. I sure can, Jonathan.
Perfect. I wanted to check with you. Have you folks seen any spread of this virus amongst healthcare providers at this point, or among healthcare providers and patients? Is that becoming an issue? I know that's been a big problem in some other places and has been a cause of some outbreaks.
I'm going to let Dr. Piercy address that.
Hi, Jonathan. Thank you for the question. We have seen isolated pockets in healthcare workers as well as isolated cases in patients. I will warn you that we are likely to see more of that, and want to reassure you that, as the governor has already stated, our healthcare workforce is of utmost importance to us. They're the ones on the front lines doing the work every single day, and we are trying to make their jobs as safe and as easy as we can as we address this. So to answer your question, yes, there have been limited pockets, and unfortunately, we do expect more.
Thanks, Jonathan. Next up, we'll go to Chris Bungard with WKRN.
Hi there. On the same way of asking as Jonathan, can you hear me?
Yes, sir. We sure can, Chris.
Do you have a sense of the unemployment numbers this week in Tennessee? We've been hearing reports over the weekend of 3 million nationwide forecasted.
I've actually spoken with Department of Health Commissioner and had our teams working together. Not only we do not have an answer yet as to how many have become unemployed in the last few days. Executive Order 17 would have started the process tonight. Actually goes into effect, and we obviously will have some significant increase in unemployment as some of these businesses begin to limit services. But I've asked our Department of Labor to track that for us as the days unfold, so that it helps us understand the implications of decisions. As you know, part of my goal is to aggressively address this health crisis that we have, but we have a lot of folks who stand to have real hard economic times as a result of this, and the decisions that we make as leaders have profound impact on people's lives, both economically and from a health standpoint, and not just COVID-19 health standpoint, but mental health, issues related to poverty and loss of work. So there are a lot of implications. We do not have numbers around unemployment yet, but we'll be working on those.
All right, we'll go to Natalie Allison with the Tennessean.
Hey, Governor, can you hear me?
Hey, Natalie, yes, I can.
Hey. Okay, so last week you had said that a couple members of your senior staff had been tested for COVID, that they were in self-quarantine awaiting results. Have any of those staff members received their results back yet, and what were those results?
One of them tested negative and one of them tested positive.
So are you taking any kind of precautions at this point? Do you know if you were exposed to them?
Well, we're live streaming this press conference, and previously we've had press conferences with large groups of folks in them. So that's an example of the very serious steps that we're taking here in our office to protect everyone. I've taken personal steps to do the same thing, and my exposure to those to the staff member that was positive was very limited. So, and I have no symptoms, so I haven't. I feel confident about my own situation, but we're taking every step we can to be safe, as every Tennessean should do.
Next, we'll go to Jason Lamb with News Channel 5.
Governor, you've urged residents to stay home. You've mentioned you've been talking to other governors across the state. Several other governors have issued statewide stay-at-home orders by now. A group of more than 2,000 doctors has sent you a letter asking you to also issue a stay-at-home order, saying we're not acting with the same boldness as other countries. The Middle Tennessee Mayor's Caucus has endorsed the stay-at-home proposal. What do you say to these doctors, and why shouldn't you be ordering all Tennesseans to stay at home now?
Yeah, I think that when you're in a situation, when you're in the position I am, that you take in a lot of information. You take a lot of requests from a lot of different people. There are a whole lot of pieces of information that say different things about the right time for the right decision. So for me, it's about the right time for the right decision in the right place. Every city is different, every county is different, every state is different. There's no one size fits all. There's no guaranteed solution. And so we're being very thoughtful to work together. Like I said, I'm talking to our major mayors. I had a call with county mayors across the state. There's an effort to do the right thing for Tennessee to slow the spread of this disease. And I believe we are doing the right thing. And as I've said a week ago or several days ago, nothing is off the table, and decisions change every day. If you're not nimble and you're not willing to take in new information and make new decisions based on new information, then you're not gonna make the right decision at the right time. But that's our goal.
Next up, we'll go to Sam Stockard from the Daily Memphian.
Yes. Good.
Okay, I lost you, Sam.
Can you hear me now?
Yes, sir. Well, no, sir. A little technical. I guess it'll be a challenge doing this. Try it again, Sam. All right, let's try to get Sam back on. We'll get you back on, Sam. We'll go to the next one, and then let's try it again.
All right.
Let's go to Alex Apple with Fox 17.
Yeah, Governor, Alex Apple here. Jason's question. I'm wondering if you have talked with any other governors about their advice, perhaps places like New York or other places that seem to get infected a little bit more quickly than Tennessee, about their advice about whether it is good for a city or state to lead as far as, putting forth something like a shelter-at-home order or anything perhaps even more stringent than that, simply because it creates more of a unified response than a city sort of going about this on their own.
Yeah, I've been on the phone. I talked to probably 5 or 6 governors individually this weekend. I was on a phone call today with probably 40 governors. I've been on the phone call with, I've talked to governors in multiple venues and multiple settings, individually and in groups, many times over the last week or two. And it's a great resource. And we just are trying to figure out together what's the best approach. And as I said, every state's different. Every approach is different. Their populations are different. The sizes of their cities are different. The densities of their populations are different. And that's the reason you have different things happening in different places. I can tell you this, every governor in this country is trying to make decisions that they believe are going to slow the spread of this disease and mitigate the economic damages to their state. Every governor is doing so. They're not easy answers. No one has found the key, in part because we're not going to stop this disease. This virus. We're going to mitigate it. And so, yes, I've talked to many, and there are different strategies going on across the country. I do think that the way we're doing it here in this state for the uniqueness of our state is the best approach, and I evaluate it every single day and talking with leaders across our state every day.
All right, let's go back. Sam, can you try again?
Yeah, can you hear me now?
Yes, sir. I don't know what it is, Sam. I can hear you ask the question, but I can't hear you finish.
All right.
Okay, are you ready?
Give it a shot.
Okay. I know that President Trump had said, he tweeted out something today saying the cure can't be worse than the problem itself. And it sounds like he's saying if it's not over in 15 days, he's going to encourage things to go back to normal. What's your response to something like that?
I haven't seen his tweets today, and I really haven't evaluated that idea. I haven't heard of that idea today, if it's changed from something earlier. But we have a long view on this. This is not going to go away in 15 days. We know that. That's in part the reason why we're setting up this unified command. It's why we are working in our healthcare institutions to develop strategies for drugs to treat and for strategies to see how this virus tracks. We are putting in place strategies for increasing our hospital beds, our hospital capacity, bringing more healthcare workers online. This is going to be quite an effort for quite some time. But if we do this right, then we can get through it in a way that minimizes the damage economically and from a health standpoint. That's what we're trying to do here. So 14, 15 days, that's a really important period of time over the next 2 weeks for Tennessee. But we have a long runway ahead of us with which to solve this problem. And I'm encouraged about the direction that we're headed.
All right, we'll go to Marta Aldrich with Chalkbeat.
Yes, Governor Lee, this question is related to the status of school closures across the state. You just said that this is not going to go away in 15 days. That would suggest that your earlier call to close schools through the end of the month will be extended as well. Is there a new date for reopening? And again, given the continued spread, what do you think the chances are that students will not be able to return to school at all this academic year? The governor of Kansas has already ordered schools to close for the rest of the year.
Thanks, Marta. We're evaluating that. We had that conversation just this morning because the date is upcoming soon about whether or not about reopening. So we're going to be making a decision in the next couple of days about whether kids come back to school on the date that we had previously announced, or whether we'll extend that closure. We haven't made that decision, but we will do that. We will be doing that this week.
Next, we'll go to Eric Schelzig from the Tennessee Journal.
You there, Eric?
All right. We'll go to, let's move on then to Stephen Elliott from the Nashville Post.
All right, technical difficulties here. You don't think he's there?
Okay. Let's do Kara Hartnett from the Nashville Post. Are you there? We'll unmute your line. Do you have a question, Kara?
Patience, everybody, while we have our first live streamed news press conference of the year.
All right, let's try Chris Peralta. Chris Peralta, your mic is unmuted.
We got to look for Sam again too. Remember?
He didn't answer.
Oh, okay. I'm sorry.
You know what?
All right.
At this point, we'll have to suspend questions for today. We will be back tomorrow at the same time, and we'll work out some of these technical difficulties in the meantime. But Governor, do you want to give a closing statement?
No, I'll just wrap up by saying the same thing I say frequently, and it's up to every single Tennessean to address this problem. We all have to own it. We all have to take personal responsibility for our behavior. And it's not just for our own health, but it's for the health of our neighbors, and especially our elderly neighbors. So do what Tennesseans do, step up. We're going to get through this, and we'll get through it together. Thank you for being here.
All right, everybody, Tracy Cornett here at News 4. You just listened to today's 3 p.m. Press conference with Governor Bill Lee. You saw that he was isolated there, speaking all on his own there on the stage. Again, he talked about 2 members of his staff being tested for COVID-19, one testing positive, the other testing negative. So there he is by himself doing his best shot and trying to do this with teleconferencing and taking in questions from the media. But I want to go ahead and recap the 7 key points he made today here at 3 o'clock. He started with some hopeful developments, mentioned a supercomputer at work figuring out a model for coronavirus, and Oak Ridge at Vanderbilt antivirus therapies being developed. He announced 615 confirmed cases at this hour, 2 deaths so far here in Tennessee. Then he went on a discussion of some of the executive orders, many of which we have been reporting here over the last couple of days. First, Executive Order 17 he signed yesterday, which said no more groups of over 10 or more people, needed to be 10 and less, I should say, and under, that restaurants are drive-through only, alcohol sold in closed containers now being allowed at restaurant drive-throughs, and nursing homes limited to essential care only. But the bigger announcement, I think, was the COVID-19 Unified Command that he is creating. It is quite a title. It includes members of the Department of Health and top military officials as well, changing the way to attack COVID-19 here in Tennessee, that he established this commission of sorts to find creative, efficient, innovative ways to increase the number of hospital beds, the increase of medical personnel we may need, and to maybe create some interesting or different or more effective quarantine measures. Fifth, he talked about medical equipment